let's start off with the first word. So before I do reflection and journaling, typically, I try to take a deep breath and kind of settle in. So hopefully you're somewhere comfortable where you can just feel at ease, not a lot of distractions. If you're like me, you might be at home bustling around your kitchen and tuning in, and that's okay too. You're present. So get comfortable if you can. And even if you're moving around, it's still all right. Just pause for a second. Take a deep breath in through the nose. Hold it and then release it out through the mouth. Do a couple more of those. Breathing is such an important thing. I know that sounds like a ridiculous statement, but we get so caught up in the bustle of everything. It's definitely helpful. All right, so the first thing I would like is for you in 1 or 2 words to describe how you feel now. Enter your responses in the chat box. 1 or 2 words only. Where are you at right now? Excellent. Grateful, irritated, busy, scattered, overwhelmed, excited. I love this concept that there is no such thing as a wrong emotion. It's what we do with them that matters. And I definitely am all for authenticity and checking in. So thank you, everyone. So we'll just keep an eye on those and see how it goes, how you feel later on in this. Okay. So let's get to introductions. Reflective journaling for peace of mind. Dr. Matt Zytkoskee, Director of Healing Arts. I'm part of the Center Foundation, which is a new nonprofit emerging in Reno. We are focused in on well-being in the community, and we're launching a lot of different programs. So definitely keep tabs on us, and we'll keep you posted on what we're going to be doing. But there will be opportunities for writing groups, for yoga, for different types of mindfulness training. Just a lot of things going on. And also, again, thank you to the Biointegrative Health Center International, who are doing the work of whole person medicine. Really not treating patients just as though they're a collection of moving parts to be worked on, looking at people as whole spiritual, psychosocial beings. So thank you for that work. I don't want to go on about myself too much, but just give you a tiny bit of background. I've been teaching writing since 2005 at university level. And in 2015 or 16, I started running group writing and working with writing for a different purpose other than academics. So started working with addiction, with illness, with a variety of different types of groups that use writing in a different way. And we'll talk about what that means exactly, writing in a different way. All right. So what is reflective journaling? One of my favorite scholars, Bob Yagalski, talks about how mainstream writing instruction, because of its obsession with the text, especially the form of the text, right? All the grammar, rules, structures, not only ignores much of what is important about an act of writing, but also fails to harness the truly transformative power of writing, which lies in the experience of writing rather than the text produced as a result of that experience. So in essence, he's talking about how our training it's all about what we're producing, the end product, as opposed to what the act of writing does for us. And reflective journaling is the opposite of that. I mean, sometimes we have amazing writing that emerges, but what the writing that emerges isn't the point. The point is in the journey. This type of writing is sometimes called expressive writing, which bounced out in the 1960s and 70s. Therapeutic writing, writing and healing, reflective writing, which is the term that you'll hear most often in medical contexts with physicians, nurses, and writing is a way of being, which comes from BIHCI. And I like this one because it really paints it as a practice in the same way that perhaps being involved in martial arts or yoga or different types of mindfulness exercises become part of how you move through the world, which is precisely what this reflective journaling is. It's a way of moving through the world. Okay, so what is its purpose? In a nutshell, increase physiological and psychological well-being. And of course, those two directly inform each other. I could easily, and you'll be grateful that I'm not doing this, but I could easily have spent an hour just talking about the research and evidence for the benefits of using these types of writing practices. But I did want to give you one quote here. Writing about important personal experiences in any emotional way for as little as 15 minutes over the course of 3 days brings about mental and physical health. This finding has been replicated across age, gender, culture, social class, and personality type. And James Pennebaker says that this demonstrates that writing is critical and it is an indicator of good mental and physical health. And I mean, this study's literally been replicated hundreds of times. So there's a lot of evidence that shows that even 15 minutes a day can be highly beneficial. Okay, so how does it work? I spent in 2000, I guess starting 2017 to 2020, I designed and implemented a reflective writing curriculum at University of Nevada, Reno's School of Medicine. And our purpose was the development of empathy, fostering of empathy, helping students with mental and physical health, the reasons that James Pennebaker noted. I conducted a great deal of research. I was completing my PhD, and I came across 3 very fundamental ways that reflective journaling, this reflective practice, works. The very first one is that it releases emotion. So catharsis, right? This energy gets stored up. I'm sure we can all relate to coming home after a long, frustrating day. And I know for me personally, often I need to just sink into a chair, and instead I'm making mac and cheese, which is being spilled on the floor, and there's a pile of bills, maybe disgruntled friends, whatever the case may be. So it provides a space to kind of just release this emotion. I wanted to give just a couple examples, or an example for each of these. One of my students that found particular release was one that was heavily involved in working with addicts, particularly in emergency care. And he was often being screamed at, dealing with patients that were repeatedly coming back, self-harm. And he just felt like he was going crazy, climbing up a wall. And so for him, sitting down a few nights a week and writing about it was a way to take this emotion and place it somewhere else, other than releasing it inappropriately on people. And I'm sure that everyone can relate to leaking frustration. So reflective journaling provides just think of it like a release valve. It's a space to vent that is safe. You're allowed to scream in your writing. And believe me, looking back through my logs, the amount of profanity is extreme. which is why I would not share it with you. But yeah, it's a space to release emotion, and that's healthy. It's also a place to process experiences. And this is big. Gabor Mate, who is one of my favorite scholar, I suppose is a way to talk about him. He works with addiction up in Vancouver. He's a medical doctor, and he says that he writes so that he knows what he's thinking. I love that quote because it's true. We don't necessarily understand what's happening with us until we get a chance to hash through it. I'm sure you've experienced this with conversations where you talk with someone and you process things through. And that's a great way to go about it as well. The nice thing about writing is that it's not necessarily reliant upon another person, or at least not in that specific moment in time. And so my work with the students and with other populations in general, the sitting down and reflecting, even for short amount of times, provides an opportunity, a space to think things through, to look at other angles. And I often think I have a handle on reality, and I start writing and I realize that there are other elements in play. I think an example that I wanted to share was of a student who, it was his first clerkship, his clinical rounds as a newbie. And he made a suggestion for a treatment of a patient. This was in a neurobiology scenario and neuromedicine. And his suggestion was accepted. And it was the right call based on the evidence it presented. And the patient was a 22-year-old mother with a 1-year-old, and he was very excited about the experience. And he returned the next morning to check in on her, and she had passed away. So you can imagine, see, I'm getting emotional thinking about just his pain and suffering over that. You can imagine how hard that was for him. And he blamed himself and he questioned medicine. Do I want to be in this? And through a series of writing, he really was able to process that he made the call that he needed to make. It was the right call. There was elements that they didn't understand at the time that revealed themselves later. And so, I don't know if I can credit the writing process to him making it in medicine, but he told me that it certainly helped him move through that experience and recognize it for what it was, because he's going to face many more of those. Third, bears witness to self and others. I love this term, bears witness. When we write, we are stepping outside of the role of the experiencer, and perhaps the way that Eckhart Tolle would phrase it, we become the watchers, we become the observers, we become the documenters, we commemorate, we honor in the stories that we tell, and we honor ourselves and others. One of my favorite pieces of writing I got from a student was from a young woman who was also in her early rounds, clerkship rounds, and she was working with an organ donation scenario. And it was the first time she had ever experienced this. And the patient was a 22-year-old gunshot victim, suicide attempt to the head. I mean, he was successful. His body was alive, but his brain was gone. And the family came in and they brought his football jersey, and she wrote about this experience. And what was amazing about it was that she captured both the family's grief and the tragedy of it, and honored this young man who I'm sure many people were highly critical of for the action he took. But she honored him for being a human being. But she also honored herself in that she was excited about the procedure, and she felt a little ashamed of this excitement. being part of this. And yet that was a very reasonable reaction to her medical training. And she also bore witness to her own emptiness and hollowness after the fact, and her confusion of emotions. And so, I mean, these are somewhat extreme examples pulled out of medicine, but how often do we all go through these exact types of scenarios in terms of conflicting emotions, pent up frustrations and emotions, and difficulty in understanding experiences? I've got to check my time, make sure I'm not rambling too much. Excellent. It's a problem I have. So even though your life may or may not be as extreme as these scenarios, to us, our lives are all extreme, right? That we are inside this experience, and this process. Whether you're writing about the fact that you want to, pull an Office Space move on the copy machine at work and smash it, or you're writing about dealing with life and death, these things matter. It's what we're dealing with, and so writing, this reflective journaling, provides us an opportunity to release, process, and bear witness. So these three things hopefully lead to the final category, which is transformation. So change. And sometimes they do, sometimes they don't. But I have found that when I become aware of something, and cognitively speaking, this is part of psychological understanding, is that awareness is kind of a critical first step in any kind of transformation. I mean, you can't change what you don't recognize. So the last example I wanted to leave with you here was so I guess I didn't even mention this, but I lost my wife to brain cancer in 2016. The fact I didn't mention it is kind of surprising to me, because I feel both obsessed with this and also exhausted with this. And that's been part of my writing process. And those of you that have dealt with trauma probably understand this push-pull between it. And I think the fact that I'm able to function in many ways and be healthy is a direct result of my writing practices. I kept a journal, a blog all throughout the 2 years that she was struggling and ill, and then the years following. And I really think it saved my life in many ways. But the example, thank you. The example that I wanted to give actually is more recent. And I thought about that for the sake that I wanted to give an example that maybe is more relatable to a larger group of you. And that is, so in the midst of COVID, I think we're like maybe 2 months in, we were staying at my lovely in-laws' home. We were quarantining. And my son got in trouble. He was, I guess, 7 at the time, and he had spent money on an online account, like a substantial amount, and got caught. And he knew he wasn't supposed to do it, and he got in serious trouble, some consequences. And I was really upset. I was working on my dissertation. I was stressed out. I was terrified of the world and everything happening. And he deserved to be in trouble, but not to the way that I went about it was intense. I yelled at him. And, I went back 20 minutes later to talk with him. He was in a room. He'd been sent to his room, and he was in the room, and he was just hitting himself in the head over and over again, like it's quite hard. And I could just hear the grunting, and it broke my heart. It was just like one of those moments where I was just deer in headlight. And so I talked with him, I held him, and kind of just let it go. But what I didn't understand was that I hadn't let it go. It wasn't okay. And it just kept eating at me, like the tears, which are still like trying to come even right now. And so what I noticed was like maybe an hour later, I just was still really distraught. And even though I had already eaten, I made myself a huge plate of nachos. I opened up a stout beer. I sat down in front of the television, even though I was facing all kinds of deadlines, and I checked out. Right. I'm sure that you guys can relate to that. I just checked out. And it occurred to me, I'm like, sit down and write, figure this out. Like, of course it's sad, but what is happening? Because I was distraught. And I did. I sat down and wrote, and not even that long, like maybe 20 minutes. And what I came to see is that first, I'd leaked my frustration with COVID and everything that was happening onto him. Like, he deserved to be in trouble, but he didn't deserve to be spoken to in the way that I did. I realized that I was involved in self-harm myself. I was sitting there putting unhealthy things into my body for unhealthy reasons. I wasn't addressing the emotions that were there. So I'm worried about him for self-harm, and I'm doing the same thing. And as I wrote, then I had this other epiphany. I thought about my own parents, and in attempts to take my own life in my early 20s. And that's a whole nother saga and story. And I thought about what I put them through. I mean, compared to what my son was doing, that was like way out there. And I had this moment of extreme empathy. And I mean, I thought about it before, but I connected the dots through this writing. And so what emerged from that was I had another conversation with him, and we talked about this like for 40 minutes, and we set up some like guidelines and a check-in system. And I also told him that I struggled with it myself and being unhealthy in some ways. And so we started communicating with each other. And the reason I'm telling you this story is because that 20-minute writing session helped me process and release emotions, helped me understand what was happening at a deeper level beyond just the immediate, like, please don't do that, to, wow, it's COVID, it's being displaced, it's the stress, it's isolation, it's, oh my gosh, here's this like cycling of generational issues coming down. And I thought about my own parents and what they had been through with their folks and stress. So it all kind of led to this transformation of behavior. And I've heard the same thing from medical students. The student who was working with in the addiction scenario began spending more time talking with some of these patients and getting their full stories. And he changed. Empathy ensued. And I can't say he was never frustrated afterwards, but this awareness came about, a mindfulness. Okay. That's the end of that saga. Let's move on. So that's how it works. So let's get into some writing exercises. And I think, yep, 527. We're doing well. So this one is the most basic, really, in some ways, or kind of I would call it nuts and bolts. This is my bread and butter. This is what I try to do on a daily basis. And actually, this practice was given to me from a psychologist, Dr. Tom Pinkson, who works in San Rafael, and he's spent a lot of years working with terminally ill children. And so he guided me on this practice. So this is what I would like for us to do. I'm going to lead you through it. So take a deep breath, get comfortable. Hopefully you have pen and paper. Personally, I like typing, which seems to be sacrilegious for some reason amongst writing and healing folks, but it's just what I do. So whatever way feels comfortable to you. First thing I want you to do is take 2 minutes to write about what's on my mind. How am I doing? Do not stop to censor, to edit, to self-judge. Don't worry about grammar. End mid-sentence, doesn't matter. We're just going to take 2 minutes to just check in. Oh, and put the date at the top. It's a daily type of reflective journal, so that's useful. I'm pulling up my timer here. When you hear my singing bell ring, then you'll know to finish up your thought. Okay. Any questions before we get rocking on this? Okay, 2 minutes starting now. All right, finish up your thoughts. I know that wasn't very much time. I'm kind of trying to expose you to a few different exercises. So maybe I just opened up the floodgate and are now having to shut it. That's okay. You can get back to it more later if you want. Do me a favor if you don't mind. And actually, no, let's wait till we're done with this full exercise. Change of mind. All right. Next up. This one is very pragmatic, and which is kind of one reason I like it too. This whole exercise can be done in 5 minutes, and I think part of our issue is that with writing, and myself included, and this is my profession, but it's this idea that oh, I don't have enough time. I need to sit down and write the great American novel, or there's the fear I'm not a good writer. I'm not. I just can't put my thoughts down clearly. You don't need time, and sometimes being a good writer is actually a detriment because you try to be too clever and creative. So this is a 5-minute exercise that can be done on a daily basis. So our next one here is take 1 minute to list achievable short-term goals for the next day or two. Include at least one thing that is for your own mental and physical health. So yeah, I'll tell you why I include this in a second, or why Tomas did. But so let's go ahead and start. And this is just listing. I mean, if you want to write it out in free form, you can, but I like to just make a list. So achievable short-term goals for the next day or two, starting now, 1 minute. That wasn't the bowl. I like the bowl better. Where is that? Okay. All right. Last part of this little exercise. Now we're going to take 2 minutes to write a prayer or a meditation, whatever words you're comfortable with, that asks for help with challenges and expresses gratitude for blessings. This could be directed at your concept of a higher power, the universe, your own inner wisdom. It does not require any particular spiritual belief other than a belief in connecting. So we're going to take 2 minutes and write out a prayer or meditation. And again, don't judge yourself on this. However it works is fine. I'm gonna have to fix that sun. All right, 2 minutes starting now. Yes. An example, there was a question, an example of a prayer meditation could be asking for help with patience, asking for some peace of mind, perhaps something more specific. Perhaps it's gratitude for having a home, whatever the case may be. So, orientating on inner needs and gratitude. I got to fix this sun glare. Okay, go ahead and finish up your thoughts. And yes, thank you for the question about specific things. I do tend to get specific with this, listing out. It's kind of looking at it from a less spiritual, more of a psychological standpoint. You could look at it as recognizing points of focus or individual need. Um, just depends on how you frame that. Okay. So I like this daily log And I try to do it faithfully because it takes hardly any time. I like that I can go back through and review back through years now of doing this. Oh, good. And I like that I'll often start off, like personally, I mentioned a lot of just like venting and catharsis in my writing. This first like couple of minutes for me, when I'm just like kind of free writing, is often venting, or maybe like I'll be talking about a dispute I had or some money issue, whatever the case. And then the goals is kind of a reorientating on a way to focus. Another aspect of the goals that I like is that I will often see how unrealistic my goal list is. Like there'll be 15 different things on there that there's no way I could get that done in the day or even in the week. And so that kind of helps me also look at it and think, okay, well, what's realistic here? Reflect on where I want to focus my energy and what is actually achievable. And this helps kind of alleviate guilt. And then the last one is the shift in consciousness. Even though I might have been literally screaming in my 2-minute initial writing, I start thinking about gratitude that, yeah, maybe my children are healthy, or, I've got an awesome burrito I'm eating in an hour. At least I've got that today, like whatever the case may be. Okay, let's go on to the next exercise. Oops. Oh no, I lost the chat box. Sorry, I have to pause this for 1 second. Where did you go, chat box? Sorry, folks. Wouldn't be a presentation without a little hitch here. There we go. Okay, I'm back. Let's play from current slide. Whoops. Okay, here's the next one. This is one that I recently picked up from a training I did with from the Center of Mind Body Medicine, and I loved it. And I think this is a really useful exercise for processing, for figuring some stuff out. So what we're going to do right now is you're going to take 6 minutes and write a dialogue between yourself and a symptom. This might mean a conversation with a body part, such as an upset gut or tense shoulders, or a talk with an emotion like anxiety, anger, or apathy. Or perhaps it's a dialogue with a daily ritual like sleeping, eating, or exercising. Be honest with it and listen to what it has to say in response. So yeah, a conversation back and forth. It can be silly, but a good way to approach this is, again, to kind of just settle into place, take a deep breath in through your nose, let it out, and think about your relationship with your body, with your mind, with your emotions, and what could use a conversation right now. What's been speaking to you already? Perhaps you're listening, perhaps you're not. So pick something and we'll start this exercise. Do you have any questions before we start? Okay. All right, so I'm setting it for 6 minutes. And let's see what you discover. Okay, that was 6 minutes. Um, go ahead and finish up your thoughts. All right. Okay. Um, awesome. I'm seeing some people had some good responses. I've also noticed this is the webinar format is new to me somewhat too. Some Q&A and some great questions that were asked. How much time do we have left here? Had one more writing exercise. So let's go ahead and do this last writing exercise, and then I'll answer a couple of the questions that were posed here. Yeah, I kind of wanted to get to this one. All right. All right. Hopefully you learned something, maybe. Let's do our final one here. Carrying grief. In a perfect world, we would probably end with something more on like the envisioning the types of future that you would like, and that's a great thing to write on. Kind of building and assembling the direction you want to go. But I feel like after the last year that we all had and everything that is still going on, it might be nice to just kind of grapple with this a little bit. So our last prompt here is take 6 minutes to respond to what grief am I carrying? How does it look? When does it show itself? And this could include old grief or new grief. It could include huge grief or little grief. It could be one grief or a collection of many. So, wow, we are short on time. This is my classic problem. Let's do it. We'll do it. I'm going to value this over me talking more. Okay, so 6 minutes. Let's start right now, and feel free to post questions in the chat box if you have them. Let's see. Okay, that was definitely rushed for the intensity of the prompt. And thank you for those that asked questions. I was asked about digital journaling, which I took to be blogging, and I posted a little response in there. We are pretty close to out of time, and I want you longer. Let's do me a favor though. I'm going to skip through that one. Let's get this last word in. In 1 to 2 words, describe how you feel now. And if it's exactly the same, that's okay. If it's more negative, that's okay as well. There's not a right or wrong answer. But go ahead and just write a little couple words in there of how you feel, if you don't mind. Great. More stuff to talk to my therapist about. Yeah, exactly. And that's actually, I'm glad, that's a great comment. Yeah, thank you. See you guys. I- when you do this type of work, heavy writing, sometimes it's good to make sure that you have someone you can talk to later on, or you're in a safe space, particularly if you're digging up anything that's too intense. Like to have a safety network in place. So something to keep in mind here. Um, oh yes, you can grieve for non-living things too. Absolutely. My goodness, I've been thought a lot about that. Okay, let's get to the end here. I'm officially out of time. There is my email address. I completely welcome communication. Love it. And I was asked about the slides as well as a recording of this. I believe it's going to be available, and I think it's going to be through the Integrative Center, but I need to check on that. Oh, I need to trigger the poll here as well. It was the one thing I was asked to do. So I'm going to launch the poll, and if you have a minute, go ahead and fill that out. And like I said, feel free to reach out to me. And if the recording is not posted on the site, I'll be happy to get a hold of it and send it the direction anyone would like. Great. Thank you so much, everyone, for showing up. Hopefully you got something out of this.